Ma'am, you can go, you can unmute yourself and start the video.
Okay, and when do we start?
We can start.
Okay.
Ma'am, you want to wait for some time more?
No, whatever. Whatever you
Okay.
want.
Okay. Okay. So good evening to all the viewers who have joined the webinar. I hope everyone is doing good and ready to learn something new from the session of today. I'm Dr. Aditi. I'll be the moderator for today. I welcome you all. Also, a special thanks to Mr. Manish Jain, sir, the director of Bijan Publishers, and the team for providing the platform Homeopathy 360 to showcase talent and to let homeopathic knowledge spread worldwide. Okay, so the topic of discussion for today is renal failure in homeopathy. Through this session, if any query arises, please drop in the chat box. We'll be discussing those at the end. Now let me introduce you to the speaker of the day, Dr. Lubnaa Kamaal. She has been now some introduction of ma'am. She has been working on chronic renal failure since almost 2 decades, and she has presented her research paper on the same topic in LIGA International Conference 2011 held in New Delhi. She was running a multi-city homeopathy clinics in North India. She decided to mentor her students personally, as they are the future of the homeopathy. So she therefore joined State Jail and Homeopathic Medical College for the same. She and her students together helped a lot of COVID patients during the second wave, for which she was awarded by World Book of Records, London. Also, she has written widely for national and international press on homeopathy. Okay, now without wasting any time, I hand over the session to you, Dr. Lubnaa.
Thank you so much, Dr. Aditi, and thank you, VGen Group, for having me here. And a very good evening to everyone over here. Today, we'll be talking about this renal failure, as is commonly known, and its management. What is its scope in homeopathy? Because see, what I have seen that there are brilliant doctors out there who do treat patients of renal failure, but they do not get very good results. So we'll be discussing this too, that why is it that despite selecting the similimum, despite having good knowledge, despite everything, I mean, applying everything, there are homeopathic doctors who are not getting good results. So we'll be discussing that as well. So the first thing is that there is this nomenclature of renal failure. We know the CRF only. We are most of us are aware with this CRF, which is the commonly used term with chronic renal failure. But there are other terms as well. So one of them is CKD, which is the chronic kidney disease. This is actually the first initial stage of the disease. And before that, I would just brief about what is renal failure, or what is CKD. So the role of the kidney is to excrete out wastes and to manage the electrolytes and the fluids in the body to maintain its balance. So if the kidney is unable to excrete the waste, or if it is unable to maintain the fluid or the electrolytes balanced for persistently for more than 3 months, then it is termed as CKD or CRF. So CKD is the first term, which is the chronic kidney disease, and this is the most initial stage of renal failure. And neither the patient is aware at this stage, nor the doctor, because there might not be any symptoms at all. The renal damage is there, but there might not be any symptoms at all at this stage. Uh, at this stage, the EGFR, the estimated or the calculated glomerular filtration rate, is when the glomerular filtration rate, when it falls below 90 ml per minute, then then the patient lands into this CKD state, or the chronic kidney disease state. When the glomerular filtration rate is less than 60 ml per minute, then it is the renal failure is known as CRF, or the chronic renal failure. And when it falls further below 15 ml per minute, then that stage is known as end stage renal disease. And there is this another term, nephrotic syndrome, where there is passage of it is altogether a different syndrome, a condition of the kidney. But it may eventually lead to renal failure. Initially, there might be just nephrotic syndrome, or the passage of protein in urine, but that may lead to renal failure. That may convert itself into renal failure, where there is rise of creatinine also. So when do we call it a renal failure? when the serum creatinine is normally it is less than 1.5, but when it rises beyond that and it is persistently at that level, that is more than the normal range, or when the urea is beyond 40 or 45, usually it's below that level. So when it rises beyond that, or the urinary protein is the presence of protein is there in the urine and it is 30 mg. So when it is persistently for more than 3 months, then it is known as renal failure or CKD or end stage renal disease, depending on the estimated glomerular filtration rate. Now, talking about the causes of renal failure, because unless and until we are aware of the causes, we will not be able to manage or treat the case. So, the most important cause of renal failure today is uncontrolled diabetes, that is, the presence of high blood sugar. So this is the most important cause, and the second important reason for the rise of the increasing incidence of renal failure is uncontrolled blood pressure. If the blood pressure is persistently high and if it is not being treated well, then it eventually damages the kidney. With blood pressure, actually, the creatinine is usually the first thing to rise. But with diabetes, it is the protein, presence of protein in the urine. So the creatinine might be initially normal. If it is due to if it is diabetic nephropathy, then the first finding might be protein in the urine. So these are the two major causes, the major killers of today, and they obviously lead to renal failure. Then the third most important cause, especially in India, is the use of over-the-counter drugs or the painkillers, because especially in smaller cities or in villages, the people usually do not consult the doctors. They straight away go to the chemists and they take the medicines, and they have this is the age of instant relief. So they want themselves to be immediately better, so they take very high doses of sometimes antibiotics or painkillers, and that is one of the most important causes of renal failure in India. Apart from that, there is a rising incidence of renal failure because of health supplements or the protein supplements in people going to the gym. So the gym instructors, they tell that take this protein and you'll be better by that, and you'll grow muscles rapidly. And I have so many patients just now in my practice whose kidneys have stopped working, or there's this failure because of using these health supplements or the protein powders especially. Then if there is any obstruction in the urinary tract, the whole urinary tract, if there is any kind of obstruction anywhere in the bladder, in the urethra, or in the ureters, or even in the renal pelvis, there is obstruction to the outflow of urine, that creates the back pressure or the hydronephrosis, which eventually damages the renal parenchyma, and that eventually causes the renal failure. So it might be because of a lot of things. There might be the most important obviously is the stone, because especially the staghorn calculi. I'm just treating a case of staghorn calculi, and the patient had been having this stone from last 2 or 3 years. Initially it was 12 and then it was in the she was just doing this every year. Annually she was just doing this. She took treatment for some time, and then she stopped taking, and then she appeared again out of blue. So now the stone is 3.2 centimeters, which is very huge, and it was obstructing the flow, and her creatinine was obviously a little high. But after 15 days of treatment, thankfully she's better, and I gave her berberis. So There might be other reasons. There might be strictures, there might be valves, there might be a cancerous growth, a tumor, or a benign prostatic hypertrophy. So any kind of obstruction, it might lead to rise of creatinine, and eventually the kidneys might get damaged. And the next important cause is ADPKD, which is autosomal dominant polycystic kidney disease, where there are a lot of small cysts inside the kidneys, and it takes up most of the renal parenchyma, and ultimately the patient starts showing signs of renal failure. But again, this is usually not diagnosed early unless and until there are like a lot of symptoms, which we'll be discussing later. So ADPKD is only diagnosed only when you get the ultrasound done. And in ADPKD patients, there might be stones as well. There are there's a lot of formation of stones in these kind of patient from suffering from this ADPKD, which is a genetic disorder. Now, speaking of the symptoms, so what is most surprising in this renal failure is that there might be no symptoms at all. The patient might be having this renal failure, they might be at CKD or CRF stage, but they might not be having any symptoms at all. And usually the first symptom appears when more than 70% of the kidney has been damaged. So the kidney is being continuously damaged, but the patient is absolutely unaware, and the doctor is also absolutely unaware. I'll give you an example. There was a patient from a young man from Lakhimpur Kheri. He just came for some other trouble, and I checked his blood pressure. It was very high, way beyond 200, and the diastolic was above 100, nearing, I think, 140 or 150. And I checked it again and again, and all the time it was like that. So I got his all these kind of tests done, and the creatinine was found to be 23. So he was absolutely unaware that he is into this much of trouble. It was like he was passing urine normally, there was no swelling. Except for this high blood pressure, he was having no symptoms at all. No loss of appetite, no nausea, no vomiting, nothing at all. So at times the patient might present this way as well. And the first symptom to usually appear is swelling. It can be facial puffiness or swelling in feet, ankles, etc. And the second thing is anemia. Usually the patients with renal failure, they appear to be quite pale. Their skin is like very dull. There's no shine in the skin. So at times you can diagnose a case just by looking at the face of the patient, because they appear to be very dull. They might not be they might not report of anything else except for this, that there's no texture in the skin. I mean, there's no shine, there is no the skin is pale as well. And then at times there are patients who have just loss of appetite, and then is when they usually go for liver tests, and the liver tests come to be normal, and then they go for kidney tests, and then they are found to be having this renal failure or rise of creatinine. So then there might be slight nausea along with this poor appetite. There might be slight nausea or vomiting. And at times the major symptom is fluctuation of blood pressure. Like there is the patient comes and they report that the blood pressure is high, and when they start taking antihypertensives, the medicines, the blood pressure suddenly drops. It becomes very low. So if they stop antihypertensive medicines, the blood pressure is very high, and if they stop it, that is what happens. It fluctuates. So that is also a sign of renal failure, and the patient should immediately be checked. And at times patient presents with the sole complaint of pains in joints, pain in legs, or pain even in back. So that is because why that happens is because there is this electrolyte, the function of the kidney is to balance the electrolytes, and the calcium and phosphorus metabolism and the parathormone, it all is disturbed. So this may be one of the symptoms. And now, speaking of the diagnosis of renal failure patients, the most important obviously is the blood test, the KFT, kidney function test, the creatinine, the blood urea, the electrolytes and all, hemoglobin, of course. So these are very important to be taken into account. Then the urine albumin test, if there is persistent proteinuria, it should be regularly checked along with the blood test. Now, and the next thing is this ultrasound, which gives the size of the kidneys and the echo texture. If the echo texture is raised, if the kidneys are shrunken, it should ring an alarm bell, even if there are no symptoms, or even if there is no rise of creatinine, or even if there is no proteinuria, then too it should ring an alarm bell, and the patient should be regularly at least monitored. So how can they be monitored is that they should see if there is just this shrunken kidneys, or the echo texture of the kidneys is raised, then they should be regularly, the blood pressure should be monitored, and the creatinine and the urinary protein should be checked at least once in 3 months. So these are the most important tests for, and they are not very expensive. And then apart from that, there is the renal Doppler. In some cases, we require that, where we have to check the blood supply to the kidneys. And then there is the DMSA scan, which is a rare test for this GFR, but it is not done very regularly with the kidney patients. So now, speaking of the prevention and the role of homeopathy, what a homeopathic consultant is supposed to do. So the most important thing is, foremost, you should, whoever the patient is, if they come with blood pressure or blood sugar, or it is together, I mean, that further increases the incidence of renal failure. If the patient is having blood pressure and diabetes both, then it should be they should be advised to very regularly check this proteinuria and the creatinine. That is very important. Then the second thing is that the patient should be advised to keep this under check, the blood pressure and the blood sugar. If the homeopathic doctor is they are treating themselves, then obviously they should check. Otherwise, if an allopathic doctor, if the patient is going to a diabetes specialist or a nephrologist for blood pressure, or even a cardiac specialist, then they should be regularly, they should be monitored for the blood pressure levels, and it should be, the medicines actually need to be changed regularly, keeping the patient's reports in mind. Because at times what happens is the patient takes a blood pressure pill, and they continuously take it for years and years, and without even knowing that it is not even working. So the salts, the doctors usually keep on changing. So this is what a homeopathic doctor can tell the patient, to keep these things in check. And then what we have regarding treatment, actually we have there is not a single medicine in allopathy or modern medicine worldwide. There is not a single medicine which can reduce either the creatinine or the urea. So what options we have is just the dialysis and the transplant. Apart from that, we do not have any, the allopathic doctors, they do not have any kind of medication at all. So what happens is, usually what I see in my practice, that the patient went to an allopathic doctor, they told him that your kidneys are damaged. Sometimes they tell about the dietary restrictions, sometimes they don't even tell, and they just tell that this is the medicine and you have to continuously take it. So what happens is that the patient is at the stage of CKD. So what happens, that they just have to progress. The allopathic doctors, they just can wait and watch, and the patient for the patient to progress into renal failure, the second stage, or the CRF, or even to the ESRD, which is the last stage for renal failure. So that is because they just can manage the blood pressure and the diabetes or any associated conditions, but they cannot give any kind of medicine to reduce or halt this renal failure, the progression of renal failure. Now the blood this renal replacement therapy, which is the dialysis and the transplant, even there are patients who cannot undergo hemodialysis very regularly. So there is the peritoneal dialysis, but what happens with peritoneal dialysis is that there are obviously some relaxations, because it is a continuous process, the peritoneal dialysis, but it usually lands patient into peritonitis, and which is usually fatal. And transplant too, I would say that there are only very few patients who take very good care of themselves, that the transplant is successful beyond 10 years. Otherwise, there are troubles, usually even after 2 years or 5 years. I have seen cases where the transplant gets rejected the very next day. So it is very limited, especially for a country like India, with such a vast population and so many endless patients of renal failure. Some 10 years back, it was 1 in 10. There were 1 in 10 patients of renal failure, and now it is 1 in 7. So it is not very feasible. Not all the patients can afford dialysis or the transplant. Now there is where homeopathy comes into play, and I can assure you that if you are careful with your patient, if you read well, and if you know how to manage, then definitely 60 to 70% of the patients can be saved. And I can assure you that as well, that even at all the stages, not just CKD or CRF, even I have helped the patients at end stage renal disease, where they were like undergoing dialysis for a very long time. There was a patient in Noida, she hadn't passed urine since 3 years, and she was undergoing continuous dialysis, and I gave her CPR in 0/2, I think LM3, LM2, LM3, and she started passing droplets of urine after 3 years. So there are a lot of things that a homeopathic ways in which a homeopath can help a patient. And definitely, if the patient comes at the stage of CKD, which is the first stage where there is minimal damage, then if you give the best individualized medicine, then obviously it helps a lot. In what way, I'll just explain it how. Because see, if there are adult stem cells. Stem cells are there in the body, and later in life there are adult stem cells, and there are adult stem cells everywhere in the body, which help in repair and regeneration. So when you give the similimum, the adult stem cells, they get stimulated, and they help the nephrons. They bring about the repair and regeneration in the nephrons, and the size of the kidney, the health of the kidney, it improves. I would quote 2 cases over here. So one of them was this girl from Assam. She was like 25, I think, and her kidneys, there's a size improved by 1 centimeter. Another patient from Basti, 65-year-old female, her kidney too improved by a centimeter or so. That is the effect of the individualized medicine. That is, but yes, obviously the individualization is very, very important. The rest of the medicines that we give for nausea, vomiting, like Ipecac, colchicum, or China. For swelling, we give epocinum and apis, eel serum, and all. So all of the cupramars also. So all of those medicines, they do help in this. They do help the patient, but the main function is of the main work is the individualized medicine. That is what works wonder for a case. And so when what happens is, when if the there are, like, everyone has two kidneys, what happens is when one of the kidney is donated, like in transplant, a donor, they donate one of the kidneys, so the other kidney, the size of the kidney, remaining kidney with the donor, it increases. How that happens, it happens with compensatory hypertrophy, again with the help of adult stem cells. So if it can happen in the donor, it can happen with the patient, in the patient as well. So this is how we can help the patients of suffering from renal failure. And another important thing is that we should, as homeopathic doctors, we should be documenting our cases. That is very important. We should be having the ultrasound of the patient, the blood reports, the urine reports, and we should get it done regularly. So that is all for just now. I hope I'm clear. And if there are any questions, I would like to have them.
Thank you, ma'am. Ma'am, I wanted to ask, there was one patient, he was having, he is 25, and he was having complaints of chest pain, and means accidental, means there was a, उसका high BP था. So we all got tested, he all got tested by the cardiologist. Everything about the heart was okay. So, and he was taking some medicines, anti-rheumatoid medicines for some swelling on the dorsal aspect of the hand. So, so some doctor advised him to the nephrologist. He did all the KFTs, and the creatinine was a little higher side. All the Ag ratio was disturbed. And the parathyroid hormone was, as you said, was also disturbed. So DMSA was advised, and the result was that his upper pole of the left kidney was damaged, and the right and the lower pole of the right kidney was damaged. And means the left kidney was, it was reported that it was impaired. The right kidney was normally functioning. So and also. So what and the doctor said, we asked about how it happened, and all the doctor said that it's कोई बचपन की चोट है. So मैम, इसका क्या मतलब है, या इसका हम कैसे उसको समझ सकते हैं, या क्या मीन्स इसका रीजन क्या है, कॉज क्या है, वो 25 का है, एंड क्या मीन्स क्या है?
See, there I have already told about this blood pressure thing. This if the patient is having persistent blood pressure, especially at this age, beyond C45, it is okay-ish. But at this stage, 25, if the patient is having blood pressure, obviously there is some kind of trouble. Then the second thing is that what you had just mentioned. What was that?
About the medicines.
Yeah. Maybe whatever medicines he was taking, so that might have damaged. And you told that the creatinine was slightly high, right?
Slightly, yeah.
So this this seems this slightly high. 70% of the kidney is damaged.
Okay.
If it is even 2, if it is even 1.7, like if it is persistently 1.7 for first month, for second month, for third month, then it can be safely assumed that more than 70% of the kidney has already been damaged. And you have this blood pressure, this very vague kind of symptoms, the chest pain and the blood pressure. There might not be swelling, right? There might
swelling.
Renal kind of symptoms. There might not be any urea. That is, the
Mm-hmm.
urine output might be normal.
No, there are bouts when he says the urine output some days of the week is high on the higher side, and on the next in the next week it's less.
When such patients they step out into on a summer day, so there is this dehydration, no? They that affects them more.
Okay.
Yeah, so that is one of the reasons why he has normal urination at times, and
No.
whereas the decreased urination at the other. Now regarding this chest pain, actually,
Hmm.
if you have got this x-ray done, there might be pericardial or
Hmm.
pleural effusion. See, what happens is, if there is proteinuria, the blood albumin or the serum albumin, it decreases,
Hmm.
and the what it causes is the pericardial and the pleural
Fusion.
effusion,
Huh,
which
hmm.
is
Right.
usually because, then the patient reports it as distressed breathing.
Right.
It
Right.
might not be persistent, but it might be at times,
Huh.
or it might be when they exert, when they sleep at some position.
He
uh,
has actually
yeah, yeah.
said. Huh.
Mhm. So, and the causation, regarding that causation, what you were discussing, so it might be because of some drugs, it might be because of injury, but a renal Doppler should be done so as to see whether the blood, the blood is reaching that part, the damaged part or not. Because there might be an occlusion, there might be some deficiency in this blood, circulation.
Okay, ma'am. So DMSA doesn't cover it. The Doppler covers it. Okay.
The
Okay.
blood
Okay.
circulation actually of the kidneys,
Uh-huh.
yeah. So if there is any occlusion in the artery, or if there is no artery at all, it might be like,
Hmm.
since birth it might not be there. There might be no supply to that part of the kidneys right from the birth. But what happens is that there is compensatory mechanisms in the body, na? So
Mm-hmm.
what happens is that the body takes care of itself, it keeps on, but with the age, with the diet, with the kind of junk food we all have, that puts pressure on the kidneys.
Kidneys,
That might lead to, because see, all this junk food is very high in sodium.
sodium. Hmm.
Yeah, so that, that altogether triggers that process of the renal damage.
And
And
also raises the BP in
there is this cycle, this whole cycle,
right
it keeps on going, there's renal damage, then there is rise of blood pressure, then again further it is renal damage,
down.
there is further rise of blood pressure. So there might be this thing, so you get those tests done, and
So,
then you
ma'am,
get.
it's like the patient has to take hypertensive also because
Yes, yes,
yeah,
yes, yes. And do not experiment. I would suggest
antihypertensive.
all the
Yeah.
homeopathic doctors to not to experiment. If patient is at this stage of blood pressure, never experiment with homeopathic medicines. Just ask them to take allopathic medicines and continue them that, because it's not very easy to manage blood pressure at this stage.
This stage.
Yeah, when the patient is in distress, there might be pericardial effusion. So there are so many complications which we might be discussing in subsequent webinars. So there are a lot of things. So never experiment with the vitals of the patient. It's better and safer to go with the antihypertensive, the medicines that are available. The modern medicines that are available. Obviously, there are some modern medicines which which cause the rise of creatinine, but then they can consult a nephrologist and get good antihypertensive medicines.
Hmm. He has actually consulted cardiologist for antihypertensive, but
No, no, no. Don't
he.
ask them to consult a nephrologist. No, cardiologist cannot just do that. I
Hmm.
have seen cases that because of the cardiac, the medicines advised by the cardiologist, it has damaged the kidneys. They are
Okay.
not aware. So they should be, ideally, blood pressure patient should consult a nephrologist.
Okay, okay, huh. So, ma'am, he consulted a nephrologist also. He advised one antihypertensive, but he's always having the difficulty in chest, the side effects of those medicines,
Yeah.
and then he
No, no,
can't
no.
take it.
No. It is not because of the side effects of antihypertensives. You
Okay.
get his chest X-ray, digital
Hmm.
X-ray, ultrasound, or if it is not visible in the X-ray, then maybe a CT or maybe ultrasound, and this renal Doppler to check if the blood is reaching the all the parts of the rest of the parts of the kidneys normally.
Okay. Okay. And ma'am, what is the prognosis of this case might be?
Actually, that depends on the size of the kidneys. What is the approximate, if you can tell?
Ma'am, I really don't remember. I really don't.
See, if it is above 8 centimeters, if the size of the kidneys is above 8 centimeters in the ultrasound, there's good prognosis. If it is below like 7, even 6 or even 5, it's very bad prognosis.
Okay.
That means that the patient was having trouble from a very long time.
हाँ,
Yes.
because he had some bouts of BP like पहले कभी हुआ
हाँ.
था मतलब जैसे कभी बीच में चेक
that
करा
is
तो
that is what happens. That is
हाँ,
what happens. मतलब इतने सारे लोग किडनी फेलियर में जा क्यों रहे हैं? क्योंकि 2 साल पहले ब्लड प्रेशर हुआ था, तब
हाँ,
हमने दवाई ले ली थी, उसके
हम्म,
बाद डॉक्टर ने बताया नहीं तो हमने दवाई बंद कर दी थी।
हम्म,
उसके बाद वो अपना खाना पीना सब खाते रहे नॉर्मली, मतलब नमक और सारा सब कुछ नॉन वेज एंड और जंक फूड सब कुछ लेते रहे, और उन्होंने कभी ब्लड प्रेशर की तरफ ध्यान नहीं दिया, एंड suddenly they come to know that their kidneys are no longer working.
हम्म।
That is what usually happens. Yeah.
Okay, ma'am. There are some queries.
Yeah, I can see. For creatinine, what medicines you will suggest? Yashasvi Verma, actually, I have already told that creatinine, there are homeopathic medicines. Yes, I would say E serum and cuprum ars, epocinum, all of these work a little bit to reduce the creatinine, but without similimum, there cannot be, you cannot expect the creatinine to reduce. So the most important thing is the similimum. And regarding similimum, I can tell you that natramure, I found natramure to be extremely useful. Then lycopodium too is good. Sulfur is very good, especially both these sulfur, natramure, arsenic, album, heper sulf. All of these medicines, I mean, I usually give them in LM potencies. If the patient comes with this abuse of medicaments, there is this symptom in the repertory. No? So, if the patient is overdrugged with something, painkillers or even diabetes medication, these medicines work very well because all of them have this rubric. And obviously, if it is because of only of blood pressure, natramure works very well. So, I mean, there can be n number of medicines, but I have found these to be very useful.
Okay, second question is what should be the approach in the treatment of CKD? What is the scope of therapeutic medicines?
That is what we have been discussing
Hmm.
all this, I mean, from last 30, 40 minutes. So the first thing is that if the patient is already diagnosed, then it is okay. But if you are doubtful, obviously you get this kidney function test and the urine test done. And then if it is high, if there is proteinuria or if the creatinine is high, then ask the patient to go for ultrasound, because that is very important for prognosis. If the size of the kidneys is small, then the prognosis is really bad, and the patient might be having low creatinine right now, but just one infection, just one UTI, just one pneumonia, just one violent fever can land the patient into very deep trouble and emergency dialysis and admission into ICU. Yeah. So the creatinine initially might be 2 or 3 or 4, but just one bout of this UTI, the creatinine might rise beyond 14 or 15, beyond 10. I mean, so then to understand the prognosis, to tell the patient, to guide the patient, you have to get this size of kidneys. Not DMSA scan or Doppler is not required in all the cases, but definitely go for ultrasound. I recommend ultrasound in all the cases, and I usually ask the patient to get ultrasound of whole of the abdomen. Why? Because see, this kind of patients, if they are if it is because of high blood pressure, usually the lipids are disturbed. If the lipids are disturbed, then usually the patient has fatty liver or some kind of liver trouble as well. So a homeopathic doctor has to take care of that as well. I can't hear you.
Hypertension and CKD, which medicine can be given?
Dr. Kaushal, actually, I usually do not recommend homeopathic medicines in a overt case of CKD. But the medicines, there are medicines which are very useful. Cratagus, Rovolfia, Strontia, Natramure, Glonine. There are numerous medicines, but if the patient is into CKD or CRF, if the blood pressure is high, then I usually do not give homeopathic medicines. I ask them to continue with the allopathic medicines, and I ask them to, be in touch with the nephrologist to take care of the blood pressure part.
One more question by Dr. Kaushal. Dyspnea at night in CKD patient, severe dyspnea, cannot lie down, has to sit and breathe.
Yeah, but you do not go to repertory for this kind of symptom, because let the common sense prevail, in the sense that this is because of what we were discussing, Dr. Aditi, what
Pleural,
we were discussing your case. So it is because of the patient is having either pericardial effusion or pleural effusion or both.
both.
So get his albumin tested, serum albumin, apart from the other test, get his protein tested, this urinary protein. If it is high, and if the patient, if the albumin level is really low, then you have to increase the intake of some sort of protein, or ask the patient to go for albumin transfusion. Suppose if it is 1.5, if the serum albumin is 1.5, you will never be able to treat the patient for this pleural or pericardial effusion, because it won't be, it will never be, the water, the fluid will be there, because the albumin is low. So at times we require albumin transfusion.
Okay.
Yeah.
Ma'am, I also want to ask about the parathyroid hormone increase levels.
Mm-hmm.
Why is that so?
See, because this calcium and phosphorus metabolism is disturbed. The phosphorus usually rises and the calcium levels are low. So because of that,
Too much.
the whole that gets triggered. Even at times there is severe deficiency of vitamin D. So
Okay.
that is another cycle. There are several cycles going on in the patient of CRF, and we have to manage each one of them. We might not be able to give medicines for everything, but we have to manage. We have to ask the patient to take supplements, because see, if the calcium level is really low, there are patients who come with their initial symptom is just pain, and the calcium level is 5 or 6. It should be usually around 9. So that is the first symptom. You get that tested. You come to know that the phosphorus is level is really high. The PTH is high. The vitamin D is really low. So you cannot give calcarea phos at that moment. The patient is in emergency, right? You either give, the modern medicine available. Uh, Usually the nephrologist, they advise, so you have to ask the patient to continue that. If they have advised Shelcal, you have to ask the patient to continue with that.
Okay. There is one more question. Medicine to control proteinuria.
There are a lot of medicines. Again, plumbum is a very good medicine for that. Then there is apis, natramure. I usually focus on this individualization. So I do not. I usually don't give medicine for proteinuria. I do not give the specifics. In my cases, it's usually the individualized medicines which take care of proteinuria. But yes, there are other medicines as well. There is sepia, Merc, Sol, then apis. A lot of medicines are there.
Okay. I mean, how is the response of homeopathic medicines? Like you have seen many cases.
Mm-hmm.
So how has that been?
Sometimes the response is right from the day one. Um,
Okay.
yeah, the patient, like I told of a case with 3.2 centimeter stone. The patient is better in 15 days. She has reported that there is increase. I haven't got this creatinine done again or the ultrasound. I've just treated her for 15 days.
Hmm.
And she's a poor patient, so I'm not going to ask her for repeated tests. But the patient is quite better. Her nausea is better. The pain in the flanks is better. The urine output is quite better. The blood pressure is better than earlier. So it can, I mean, if the medicine that has been chosen is like similimum, it can give you results in 15 days flat. Yeah.
Okay. Ma'am, Dr. Kaushal Bhanushali has requested to speak. Maybe he has some queries.
So how?
I have given Dr. Kaushal, if you're listening, you can try speaking. Uh, Hello? Uh,
I can't hear.
mhm. Also, the nephrologist for the problem gave medicines for to means curb down the radical means the negative radicals
Mm-hmm.
harm
Free
to the
medical.
kidneys. But when he's taken, he's having pain in the abdomen, so he can't even take those.
Mm-hmm.
So what could be means why has he given means what means any मतलब कोई देने का मतलब था वो.
Antioxidants, you mean?
हाँ मे बी हाँ हाँ एंटीऑक्सीडेंट्स हैं इसलिए आप इसलिए
Antioxidants, yes, 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 they can take, but sometimes actually क्या होता है कि किसी को कोई antioxidant सूट करता है, किसी को कोई सूट करता है.
ओके.
And antioxidants can be given. I mean, बहुत लंबे समय तक एक ही नहीं देना चाहिए है. It should be stopped and then it can be started again. But it actually antioxidants. One antioxidant cannot work for all the patients. कोई किसी को सूट करेगा, कोई अगेन किसी को सूट करेगा. And Dr. Kaushal, you have asked medicine to control proteinuria. So I'll mention one medicine which I've found to be extremely useful. Two of my current patients suffering from gross nephrotic syndrome, they are on Hepasulf and LM potencies I'm giving, and it is working very well. So the first patient, he's a 12-year-old boy, and the first time I saw him, he was like swollen from all sides. He looked like a balloon. And from then on, the episode hasn't recurred. The nephrotic syndrome hasn't recurred, because see what happens is it recurs after a few months or maybe in a year. The nephrotic syndrome, it keeps on recurring. There is sudden proteinuria, and there is sudden, all of a sudden there is swelling. Yes, please.
Hello.
Yes sir,
Yes,
you
please.
are audible.
Madam, I would like to ask one question, that up to what creatinine level we can avoid by giving homeopathic medicines, and we can avoid the dialysis.
No, no, no. That is actually independent of creatinine level.
Okay,
In India, what happens is even after 5, they ask the patient to go for dialysis. I've seen there are nephrologists who suggested my patient to go for dialysis for when the creatinine level was 8,
okay,
and it has been a year, and they
okay,
haven't undergone dialysis even once.
okay,
So it is independent of the creatinine level actually, but the rest of the things, the swelling, the urine output, the discomfort in breathing,
okay,
all those, or the depression in bone marrow. What happens is if the urea is high, persistently high, and you are giving like the erythropoietin injections and all to improve the anemia,
hmm,
this hemoglobin level fails to rise. So
okay,
then is when the dialysis is required. So there
okay,
might not be any other symptom.
Okay.
Except for this anemia, there might not be any other symptom. There might not be swelling. There might not be any deficit in urine output. There might not be anything at all, except for
Okay.
this, because urea causes depression of bone marrow.
Okay.
And if it is not removed from the blood, the hemoglobin won't be there.
Okay.
The
Okay.
RBCs,
And madam, what the potency of epocynem should be given in case of swelling of the extremities in CKD patients?
again, actually, that depends from case to case. I usually use it in tincture or this in 30 potency.
Okay. And madam, regarding hypertension in CKD, can we give higher potencies like 10 m, 50 m for Ravalfia?
I have never tried that. Maybe you can and let
Okay.
me know.
Okay.
Yeah,
Okay.
but Robolfia actually works better in tincture form.
Okay. But we
Strontia,
have tried. Yeah.
Strontia I tried in 30 potency and it gave me good results. But Robolfia, almost always, it has used in tincture. Okay.
Okay. Madam, what is the role of Litrus piccata in chronic kidney failures?
Yeah, it has also some role in reducing this creatinine,
Okay.
some role in improving the symptoms, but you cannot rely completely on that. You
Okay.
just cannot give that medicine and forget, or eposinum or any other medicine and just forget that it will take care of the creatinine and everything. You have
Okay.
to select the similimum. Yes.
Okay, madam. Okay. Thank you, madam.
Can't hear you.
This was a very wonderful and informative session.
Thank you.
And I want to tell the viewers that this was not the last one. Ma'am will be continuing with the proper diet and management uh, means webinars further, and
Yes,
we'll
we'll
be
be discussing cases as well
and cases also.
later on.
Okay.
Thank you
Thank you,
so much.
ma'am.
Thank you. Thank you so much.